Good morning. This is Rebecca Strauss with Miller Johnson. Today I am joined by my colleague and friend, Sandy Andre. Good morning, Sandy.
Good morning, everybody. Good morning, Rebecca.
We have lots of people joining us this morning, Sandy, so we're going to just take a few more seconds and let those folks filter in. It does take a while, just a minute or so, for lots of folks to filter in to Zoom. Today's webinar, as you know, is about the FFCRA, a refresher. Now, we'll answer one of the questions first that came in. As you know, when you register for our webinars, you can type in a question. And one of those questions is anything new? I loved that question because it made me laugh. The answer is no, which then leads to the next question. Well, then why the heck are we having this webinar, Sandy? We are having an FFCRA webinar because the numbers in Michigan, for those of us attending this webinar in Michigan, and frankly in most states across the country right now, are spiraling upwards. So what was once a hypothetical situation under the FFCRA where you knew about it and you had your policy in place, but maybe you didn't actually have to make the tough decisions about who qualified and who didn't in specific circumstances, or maybe you did it once a month and maybe it was an easier judgment call. Now you are faced with those questions, my guess, is on a weekly basis, some of you on a daily basis, and so the volume of FFCRA decisions you have to make now on a daily and weekly basis is so high that there's lots of questions coming up. So even though nothing has changed recently, we at Miller Johnson are seeing an uptick in FFCRA questions. And so when that happens on our end, in our day-to-day work, that's how we know it's probably on a lot of your minds. So with that, let's get started. I'm in charge of the slides today, which is a little scary. Today, we are going to talk about the FFCRA, the original, okay, what we were all used to that was effective back April 1st. There were some amendments back in September. They are not going to rock your world, but we are going to tell you about those amendments so that you know the most up-to-date version of the FFCRA. And again, that's not breaking news, but you should know what the current FFCRA says. And then we are going to go through some very common questions that we have been getting. Some of them were asked, again, before the webinar. Some of them are just the client questions that Sandy and I and our colleagues have been fielding the past 2 weeks or so. And obviously, as always, you can type in questions during the webinar. We will not be able to get to all of them with a crowd this size, but we will do our best to pick out the questions that maybe are asked more than once or pick up on a theme and get to those. Okay, so let's get started. The FFCRA, the original, right, back March, April, does everyone remember this? It seems like a lifetime ago. The original FFCRA, effective April 1st, 2020 through December 31st, 2020. Those are still the effective dates. We know a common question is this actually going to expire at the end of 2020? Don't worry, we are going to get to that question. It applies to public sector and private sector with less than 500 employees. It has two major components. The EPSLA, emergency paid sick leave. Employees are immediately eligible for that. There's no waiting period. Employees are eligible for up to 80 hours of paid leave. Okay, and there's 6 different reasons. We're going to go over those in just a moment. 2 weeks of paid leave. If it's for 3 of the reasons, though, it's only 2/3 of the regular pay, up to, and it's all capped. The expanded FMLA is you have to be an employee for 30 days before you're eligible. You get up to 12 weeks. 10 of those are paid. The first 2 can overlap with the ESPLA, and the expanded FMLA is only for childcare. Just as shorthand to sum it up, if the child's daycare or school is closed, is available for that reason. Let's dig in a little bit more into the EPFLA. There's 6 different reasons an employee can qualify for that 2 weeks of paid leave. First reason is if the employee is subject to a federal, state, or local quarantine or isolation order related to COVID-19. If they cannot work for that reason, they are entitled to their normal pay up to a cap of $511 per day, and then there's a total cap too over the 2-week period. If they have been evaluated by a healthcare provider to self-quarantine because of COVID-19, they get their full pay. If they are experiencing COVID-19 symptoms and they are seeking a medical diagnosis, they're entitled to their full pay. If they are caring for an individual subject to 1 or 2, they are entitled to 2 weeks of paid leave, but it maxes out at 2/3 of their regular pay and $200 a day cap. That includes, by the way, a child who falls under categories 1, 2, and 3 and may not have symptoms, but can't be home alone, right? So that would count under 4. 5 is caring for a child whose place or school or place of care is closed due to COVID-19. That again is 2/3 pay. We're going to talk a little bit later in this presentation about what counts as a child, because that is a common question. Employees also qualify if there's a substantially similar condition as determined by the Federal Department of Health and Human Services. That has not happened. Okay, when that happens, we will all know there will be a formal type of announcement of that, so we don't have to worry about that. Remember, for child care leave, it is only available if no other suitable person is available to care for the son or daughter during the period of leave. I've had numerous questions since April. What if there's a stay-at-home spouse, right? If the spouse is available to care for the son or daughter during the period of leave and is doing so, then the employee is not entitled to FFCRA. If the spouse is working, however, even if remotely, but they are working so they are not available to care for the child, then your employee is entitled to FFCRA. FFCRA is not available if the school or child care provider is closed for a non-COVID-19 related reason. Okay? For instance, Christmas break. Okay? So, Sandy, do you want to tell folks about what happened with the FFCRA because of a court challenge and then some new regulations that were issued?
Perfect. Yep. Thanks, Rebecca. So you can go ahead and go to the next slide. So if we remember, for those who have been along this ride the whole time, you remember that shortly after the Department of Labor issued its final regulations, actually the state of New York sued the Department of Labor and took issue with 4 specific areas of the original FFCRA in the DOL's regulations and interpretations of that. The work availability requirement, the definition of a healthcare provider, various aspects of the intermittent leave component, and documentation. And so the state of New York said the agency exceeded its statutory authority in the way that it drafted those regulations. So late this summer, there was a court decision in the Southern District of New York, and generally, the judge, at least related to those 4 specific areas, agreed with the state of New York and said, yep, the DOL has exceeded their statutory authority related to these 4 things. And it just kind of hung out there. And we were all thinking, well, what does that mean for Michigan employers? What does that mean for all of the rest of us? So long story short is that in September then, the DOL responded to the court ruling by amending the regulations in these 4 specific areas. And so for some of them, and you can see this there, some of them, the DOL didn't say, hey, we agree with that court ruling, and so we're going to change our rule to go more in line with what the judge and what the state of New York was saying there. Instead, they doubled down and said, nope, this is how we're going to interpret it, and in some cases provided some additional explanation to hope that that passes muster when that portion might be challenged again. But in some other areas, and you can see that there on the screen, they did revise it. So let's just really quickly go through those 4 specific areas, because as Rebecca mentioned, if you were doing a lot of FFCRA stuff in the beginning, but you haven't done it in a while, this type of piece might have flown under your radar a little bit related to some of these changes. Next slide, please. So let's first talk about the work availability requirement. And so there, the DOL says that the FFCRA leave is available only where an employee has work available to be performed. So the DOL says the inability to work has to be only, right, the sole cause of me needing leave has to be one of these FFCRA reasons. If, for example, my employer lays me off or puts me on furlough, I no longer have a need for leave for one of these COVID reasons. That's a completely separate economic related reason. Certainly, the economics of the decision to lay me off have something to do maybe with the COVID-19 pandemic, but the Department of Labor's position is still the employee's need for leave must be the sole reason the employee is not working. So I've seen a couple of questions come in already that talk a little bit about that. So remember, if you put someone on furlough or you put someone on layoff, as it stands right now, that individual would not be eligible for FFCRA leave because they don't have a need for leave for one of those questions, okay? Now let's go to reason number 2, which is here on the screen, the definition of a healthcare provider, and this is a big one. So you may remember in the very beginning, the initial regulation was that employers may exclude from FFCRA leave any individual who falls into this definition of a healthcare provider. And you may remember that they define the term very, very broadly. Essentially, at that time, the focus was on the type of employer you work for, okay? So if I work in a hospital at the time, right, maybe no matter what I am doing, maybe I fall in that definition. And so the state of New York said that's way too broad, and we're excluding a number of people for leave that the FFCRA was intended to cover. The court agreed. And so this is one area where the DOL responded with a revised definition, and that's really important, okay? So the new definition really, long story short, is really more of a focus on my individual job duties rather than the type of employer that I work for. So the revised definition, according to the DOL, individuals who fall into this exclusion that an employer may kind of push the lever and say, no, you're not allowed to take FFCRA leave, are those who are employed in diagnostic services, preventative services, treatment services, or other services that are integrated with and necessary to the provision of patient care. So we all can read words on the screen. So you might be sitting there and going, okay, great. What the heck does that mean, right? So they have given us some examples, and I can talk to you a little bit about those. Diagnostic services are going to be folks who are involved in taking or processing samples, performing or assisting in the performance of x-rays or other diagnostic tests or procedures, and folks who are involved in interpreting test or procedure results. Preventative services can include folks who are involved in screenings, checkups, and counseling to prevent illness, disease, or other health problems. Treatment services can include individuals, who are involved in performing surgery or other invasive physical interventions, prescribing medical or providing or administering medications, physical therapy, and providing or assisting in breathing treatments, right? So I think about maybe our respiratory therapist there. And then when we talk about kind of this last category, services that are integrated with and necessary to those services, what could that possibly be? And so they've told us that that can include bathing, dressing, hand feeding, taking vital signs, setting up medical equipment for procedures, and transporting patients and samples. And so they've provided us a number of types of jobs that is included to encompass nurses, nurse assistants, folks, laboratory technicians. Those types of individuals certainly fall into one of those categories. But maybe more importantly, they've given us some examples of who this definition is not included to, or not intended to include, rather. And the examples they give us include IT professionals, building maintenance staff, human resources personnel, cooks, food service workers, records managers, consultants, and billers. So let's just pause here a minute. So what does all of this mean? So the takeaway here is, particularly if you were a healthcare employer, so your facility, hospital, physician office, a dental office, all of those things, and you took the approach in the very beginning that anybody, in your four walls under your roof, you were going to exclude them from FFCRA eligibility. A number of those individuals can still be excluded under this new definition, but the focus now needs to be on that employee's duties. And if they fall into one of those four categories, you may still exclude them, but it's not nearly as broad as it was, okay? That one is a tricky one, and so that was a lot, but we'll go ahead and keep moving forward. Next slide, please. Now let's talk about, remember we talked about there were four provisions of the FFCRA that were challenged in four pieces here. Number 3 was related to intermittent leave. And so the DOL's position in the very beginning, and you might remember this, this is one of those that has not changed. So no rewiring our brains and retraining our brains on this one. So the DOL said, listen, there's only going to be certain circumstances, right? There's 6 reasons somebody can take emergency paid sick leave, and 1 reason people can take expanded FMLA. And only certain of those circumstances are individuals going to be able to take intermittent leave depending on the specific circumstances of somebody's situation. Because in an effort to limit the risk to other employees and mitigate the spread of COVID-19. If I'm out with symptoms today and seeking a diagnosis, I'm not going to go get my test and then come back into the workplace and work the rest of the day while I'm awaiting those test results, as an example, and only take emergency paid sick leave for the couple of hours that it takes me to go get my test, and then I'm going to come back to work. That's an example of where intermittent leave, the DOL did not intend intermittent leave to apply to those situations. And so the second component of intermittent leave is, yes, there's only certain circumstances where it's okay, but number 2, employers must consent before an employee can take intermittent leave. So it's not just, am I feeling well enough to work a little bit, if I'm working remotely while I'm waiting for my test results or whatever the situation is. Miller Johnson, if it's me, Miller Johnson has to say, yes, Sandy, go ahead and take this leave intermittently. That's the DOL's position. And so the court said, yep, we totally agree that this intermittent leave should be limited to only certain circumstances, but we totally disagree that employers must consent. And they thought about it as we think about the FMLA, right? There's some pieces here that an employer doesn't necessarily have to consent to intermittent leave, right? There's certain pieces that they do, and you have to scheduling and all of those pieces. But they were thinking about it more like, no, leave under this act is a right, and the employee has the ability to take it in whatever chunks of time that they want. And so, again, this is one that the DOL doubled down. And they expanded the rationale for why employer consent should be required, but they stood firm. So we all agree that as we look at the 6 emergency paid sick leave reasons and the 1 expanded FMLA reason, only certain situations are going to even be eligible for intermittent leave before we even talk about employer consent, but the DOL's position remains the same. that it is only available when the employer consents. Now, I say that and follow it up with a little bit of a caveat. The DOL has certainly signaled in some of their companion guidance documents that they are encouraging employers to work with employees in grant leave when somebody is eligible in a way, in the most flexible way essentially possible within the parameters of the law. So even though they double down on the requirements, they have signaled in some of their guidance that they expect and want employers to have some flexibility there. Okay, let's go to reason number 4 under the amendment. So the amendment, or excuse me, the issue here was related to documentation. And so initially, we know, and we'll talk about it in just a minute, that an employee is required to submit some documentation substantiating the employee's need for leave. We know that we can ask for some things, although very limited. And the DOL's position was that the employee needs to be submitting that documentation prior to the employee taking leave. And the court said, we agree, the documentation needs to happen, but no, it's not appropriate to require it prior to leave. And so this is one that the DOL revised. They said, okay, we agree. Documentation, of course, can be requested to substantiate the need for leave within certain parameters, and it's perfectly appropriate to tell employees that they need to provide that to us as soon as practicable, but we do not think that the documentation substantiating leave needs to be required prior to the employee taking leave. So that is where we've landed. So if I had to summarize, I want to say that an individual still is only eligible for FFCRA when there is work available for them to do, but they need to take leave from that work for one of the 6 emergency paid sick leave reasons or one expanded FMLA reason. Remember that definition of a healthcare provider now is much more narrow. It's a focus on an employee's job duties. Individuals can take intermittent leave only in certain circumstances, and the employer does have the ability to consent or deny intermittent leave, request for intermittent leave. And documentation, limited documentation, an employer can still request limited documentation and request it as soon as practicable, but cannot require an employee to provide it to them prior to the employee taking leave. Okay. Whew. I think this next slide sums it all up. That's a lot of information, but kind of gets us back to level playing field. It refreshes us up on some of the original Act basics and talks to us a little bit about the amendments. But now let's talk about questions. Rebecca?
Yeah, Sandy, let's give you a chance to breathe for a moment. Our first question is also one that has come in live during this webinar already, asked a few different ways, but essentially the questions go to how does PA 238 interact with FFCRA? In other words, if an employee is home because of the requirements under PA 238, does that person qualify for FFCRA? One question has to do with quarantine, for instance. Another question refers to the state mandate. But remember, this is a DHS mandate. But just to get everyone up to speed real quickly on where we are with stay-at-home, in other words, don't go to work in person, requirements for sickness or exposure, we need to look to Public Act 238. This is similar but not the same as the original Executive Order 36, right? We were all used to talking about EO 36, and then it became another EO, and then the EOs were struck down, and then the legislature got involved and passed a law called Public Act 238, a very fancy name. And Public Act 238 says employees should not go to work, and I'm being a little overbroad here because this is not a webinar on PA 238, but employees should not go to work if they themselves test positive or have symptoms or if they have been in contact with someone who has tested positive or has symptoms. Right now, there's all sorts of days requirements and all those sorts of things, but that is the basic requirement, Public Act 238. So how does that fit in to the FFCRA? First of all, a person fitting under either of those categories, and that's the reason they're not working, would not qualify for expanded FMLA. That's an additional 10 weeks, because that's just for childcare reasons, okay? So we're just talking about emergency paid sick leave, those first 80 hours of pay. Let's separate the question out into two different categories. I'm gonna take the easier one first. I'm gonna use my discretion to do that this morning. It's been a busy week. Let's talk about the employee who themselves has symptoms or has tested positive for COVID-19. Okay, do they get FFCRA? Let's flip back to the reasons that you can qualify for emergency paid sick leave. And I'm going to actually, I don't normally do this during a webinar, but I'm going to actually flip back through the slides so we have them right in front of us, okay? So these are the reasons an employee says, I'm not coming in because I've tested positive or I have symptoms. Then we go to this list and we say, which one of these could this employee fit under, if any? Let's look at number 3 first. The employee is experiencing symptoms and is seeking a medical diagnosis. Well, that could fit, right? Not necessarily based on the hypothetical I gave you, but maybe. So we need to ask some more questions, don't we, right? We need to see if they're actually experiencing the symptoms. Remember, this is not a close contact case, so they are actually experiencing symptoms and they are seeking a medical diagnosis. So we have to ask, have you called your doctor, right? Are you waiting for a test result to come back, for instance? Someone who got a test, as we know, the waiting time to get a test result back can be frustratingly long. Maybe they're in that waiting period. That would count under number 3, okay? What about number 2? Have they been evaluated by a healthcare provider and recommended to self-quarantine by that healthcare provider? Then they would qualify. So we need to ask, have you seen a doctor? Call the doctor. By the way, when I see seen telemedicine works, okay, don't take that too literally. Have they been in contact with a healthcare provider, and has that healthcare provider recommended that they self-quarantine because of COVID-19 positive test or symptom? If that is true, they qualify. Now, what if neither of those things happen? What if my example is still true? The employee calls you and says they have symptoms, but they are not seeking a medical diagnosis currently, and a healthcare provider has not told them to self-quarantine. But under PA 238, they are not supposed to come to work for in-person work. Then could they qualify under number 1? Are they subject to a federal, state, or local quarantine or isolation order? This is where lawyers start having fun. Sarah and I did a webinar, Sarah Willie and I did a webinar on PA 238 when it first was passed, and we talked about this very question about whether PA 238 is a state quarantine or isolation order. To be honest with you, there are arguments that go both ways on that. I can give you a very reasonable and persuasive argument on both sides of that question, but we think the better answer is yes, okay? But before going down that road, if that is the only reason an employee might qualify for emergency paid sick leave, that's when you should reach out and contact one of us or your favorite employment lawyer or whoever your guru is for these sorts of things, because that is a judgment call. We think you have an excellent argument that that person would qualify for FFCRA, okay? So that's the person who has the symptoms. That's the first example. Let's go to the second example now, and this is one of the specific questions asked. A close contact case. Okay, remember the other reason under PA 238 a person can't come to work is if they have had close contact with an individual who is symptomatic or has tested positive. Now we go back to the FFCRA reasons, and we see if any of them would count. Right here, we're going to start with 3 again. That wouldn't count this time, right? Because the employee is not experiencing symptoms. 2 would not count. They haven't been evaluated by a healthcare provider. Okay. Let's flip to 4 for a moment. If the employee is caring for an individual subject to 1 or 2. So in my example, I said close contact, but I didn't tell you who the close contact was. What if it's a young child? What if it's a young child who does fall under 2 or 3, and the parent needs to care for them? Your employee needs to care for them. Then they would qualify under reason number 4. What if the close contact is not a child? What if your employee was at a party, right? And then a day after the party, someone called and said, yeah, this person you were talking to all night at the party tested positive. You should know that. Under PA 238, they should not come to work for 14 days after that close contact. And then we get back to reason number 1. And just think back to my comments from a minute ago, right? So is PA 238 a state quarantine or isolation order? We think there's an excellent argument that it is, but you may want to check in with us before you grant FFCRA leave in that situation. Okay, so that is how PA 238 and the FFCRA fit together. There is no easy shortcut here. I can't tell you if yes to PA 238, then yes to FFCRA. It's not that simple of a line, right? We need to actually look at the reasons and think about, right, what that person may qualify for. Okay, let's go back to the next question. Do I have to pay my employees for being out if they already used up the allotted 80 hours? Under the FFCRA, no, unless it's a reason that qualifies under emergency family medical leave. Remember, the FFCRA has 2 parts: emergency paid sick leave and expanded FMLA. Emergency paid sick leave is 80 hours, period. And when it's up, it's up. Now, if you also have a PTO program or sick leave or Michigan paid medical leave or other paid leave, you then add that on. Emergency paid sick leave comes first. That 80 hours comes first, always first. And it's in addition to any other paid leave you offer employees. Okay? So once they're out of 80 hours, if it's reasons 1 through 3, then they're out of emergency paid sick leave under the FFCRA. They do not qualify for EFMLA. Those aren't childcare reasons. So you flip to your own paid leave, and then once that's out, it's out. Okay? If they are gone for a childcare related reason, reasons 4 and 5 on our list, right? As either they are caring for someone who is quarantined or isolated. By the way, that doesn't have to be a child. It could be any family member. Close contact, we're going to talk about that in a moment, people you live with. But if they are out of work because they are caring for someone else or their child's school or daycare closes, you get the 80 hours, and then they flip to an additional 10 weeks of expanded FMLA. Expanded FMLA is paid. It's not full pay. It's 2/3 of the regular pay, capped at $200 a day, as is those first 80 hours. Okay, let's talk about a question we've been getting lots and lots about grandchildren, but we're going to expand that a little bit and make it a little bit broader, right? Who counts in terms of who I can care for that needs my care, children, and whether my employees qualify for FFCRA for those reasons. Okay, there's 2 emergency paid sick leave and EFMLA reasons that talk about caring for others. One has to do with a child's daycare or school closing, okay? If that is the reason an employee can't work because a child is that has a school or daycare that's closing, we have to ask ourselves, is that child a son or daughter of the employee? Those are the words used in the law, son or daughter. Now, because it's a federal law, nothing's that simple. We can move beyond biological sons and daughters. Others, including grandchildren, could count if they meet the definition of son or daughter under the general FMLA. And in general, it can count if you're a legal guardian. So if the grandparent is a legal guardian of the grandchildren, they can qualify for that type of leave. Or even if they don't have legal guardianship, if they stand in the place of the parent, if they act in a parental role towards the grandchildren on a day in, day out basis, not just during COVID, but more generally. And there's a list of factors, but generally if the children live with them, if the grandparents feed them, pay for their care, take them to school, and taken over the role of parenting, that can count. That's a fact-specific situation. That's the sort of situation you're probably going to want to touch base with us on. But keep in mind, it is possible for grandparents or aunts and uncles or whomever to take that type of leave for children whose schools have closed, even if it's not their biological son or daughter. Now, let's look to another reason that people need to care for their children or other human beings in their lives. If that person is ill or quarantined or isolated because of COVID-19. Under the emergency paid sick leave, so just the first 2 weeks, emergency paid sick leave and emergency FMLA, can stay home to take care of someone who is staying home because they are isolated or quarantined. The rule there is you have to have a personal relationship with that person, and it has to be the type of relationship where that ill person, quarantined person, would expect you to be the person to take care of them. Oftentimes this is referred to as someone in your household. It could be your spouse, for instance. If there were some people get very seriously ill from COVID, some do not, some do. Some seriously ill people do need someone at home, right, to make their meals and take care of them. So again, grandparents could qualify for grandchildren. Certainly if they're in the same home, that would be a lot easier. But even if they're not in the same household, you may be able to make an argument that they would be a person that would normally be expected to take care of the grandchild in that situation. Okay, let's go on to 2 more questions, and then we'll turn it over to Sandy for what I call the rapid fire questions. Does FFCRA leave, either emergency paid sick leave or EFMLA, have to be used all at once? Or can it be for multiple COVID-19 related events? Again, this is one we've been getting live here today too. It does not have to be used all at once. And that's one where I don't even have to get into the gray much. There are caps, right? Emergency paid sick leave act is capped at 80, but it can be 40 hours and then 1 month and 40 hours the next month, right? Expanded FMLA, same thing. The events of COVID-19 related events do not, COVID-19 related events do not have to be related to each other. It doesn't have to be the same illness or quarantine, etc. Let's talk about schools for a minute. This is a hot topic as lots of schools are going to remote now. Does an employee qualify if their child's school just transitions from in-person learning to remote learning? So this goes to the reason for FFCRA, right? If a child's daycare or school has closed, and what does it mean to close? If remote learning is still happening, and in my child's district, in my children's district, for instance, that the teachers are in the school building, they're there teaching, but my kids are home, right, learning from their bedrooms. So the school is technically open, it's not closed like it was in April when nothing was happening. What does that mean? Focus on whether your child can go to a brick or mortar school or not, and that directs the analysis. So if your child cannot go to brick and mortar school building to learn and must learn from home, that qualifies under the FFCRA as a school closure. Okay? Think about it this way for young children. If the child is learning remotely, let's just say a first or second grader, is learning remotely from home, the parent cannot leave the home to go to work, right? They obviously have to supervise the child. If the child is in a brick and mortar school building, now the child is cared for and the parent can come for in-person work. So that is how you should think about it. So remote school only, there is no choice to go in person. Only option is at home, remote learning, then that employee would qualify for FFCRA. Let's talk for a moment about the age of the children. That is not on the slide, but I see we got that live during this webinar, and that's a really good question. I think the question specifically was, what about a high school student? What about a high school that goes remote? Is a parent entitled to FFCRA under that situation? Interestingly, the Department of Labor doesn't speak to that, but the IRS does. Just to make our lives even more fun, there are two agencies that are involved in deciding who gets FFCRA. There's the Department of Labor, that's the primary, but remember, you're getting a payroll tax credit for any benefits you pay to employees under the FFCRA. Then the IRS steps in and says, okay, employer, to get the tax benefit, you need to show us the following information to show us that the person actually qualified. And one of the IRS requirements is that if the child for whom the employee is seeking to stay home is over 14 years old, okay, are you with me? So 14 and younger is fine. If the child is over 14, so 15, 16, 17, right? During daylight hours, you need to explain the special circumstances that explain why you have to be home with that child. So there is a presumption for 15, 16, 17-year-olds that a parent does not have to stay home even if the child's school closes, but there may be special circumstances that do require it. And I'm not going to go through all the possible examples. There are many, many, many. The DOL has also said, by the way, that children, your son or daughter over 18, you may also still be able to stay home with them if there are special reasons why they need care. And most often this has to do with our sons and daughters that may have a disability. So they're in some sort of care situation during the day, which is what frees up the parent to come to work, and then that care situation closes down. So even individuals over 18 can possibly still count as sons and daughters where the parent can take FFCRA leave if their care shuts down. All right, let's go to Temp Employees real quickly. This is a question I have been getting sporadically since April, but I think I should be getting it more. So we're going to talk about it a little bit more. Most of you, my guesses, are not counting temp employees towards whether you have 500 or not, and you're not considering whether you have to provide leave for temps. For counting employees and for providing leave, you can be considered a joint employee of your temps. Okay, the DOL will apply a control test to decide if you are a joint employer. If you exercise either indirectly or directly significant control over the terms and conditions of the temp's work, then it is possible that you are a joint employer of that temp and you are on the hook for FFCRA leave for that person, okay? So to determine whether the second employer, whether you exercise the control, the DOL is going to look at whether you have the power to hire or fire temp. By the way, this is different than whether the temp should be assigned to your business, right? Whether you have the control to hire or fire, whether you supervise and control, schedule, and conditions of employment. My guess is that is almost always the case is that you do, if you determine the rate and method of pay, and if you maintain the employment records. And all of those factors are weighed against each other. It's not an all or nothing situation. So if that is not a thought that has crossed your mind until now, you may want to put some thought into it and let us know if we can help you work through that issue. Okay, Sandy, do you want to take on what I'm calling the rapid fire questions on slide 19?
Yes, of course. Thank you, Rebecca. So the first two questions here are related to FFCRA exemptions. Remember, if you are an FFCRA covered employer, you have the ability to say folks who fall into either of these two definitions, someone who's a healthcare provider or somebody who is an emergency responder, you have the ability to say, no, we are not providing you leave. But I want to just spend a couple of minutes here on the tricky part, right? We all know how to read words on a page, right? And so that's not where this gets tricky. Where it gets tricky is how these two definitions actually are used in other laws that are in the shadows of this same area. And so it's really important for us to keep it straight. And so as Rebecca kind of started our Q&A portion of the presentation here, it's really important to remember that Public Act 238 that applies here in Michigan is completely separate from the Families First Coronavirus Response Act's paid leave provisions, right? So the definitions in each of those acts and exclusions and things like that, they are totally and completely separate. For example, the FFCRA has an exemption if you are a healthcare provider or an emergency responder, and is very specific on what those definitions are. And under PA 238, healthcare professionals and first responders are exempted from some of the close contact provisions. And so what I will say is your employee, who you may colloquially think of or anecdotally think of as being in one of these types of categories, may not fall into both, or may not actually fall into either. So the moral of the story is just because an employee falls into the definition of one, either under the FFCRA or under PA 238, don't think that that automatically qualifies that individual to fall into the exclusion for the other. And so as related to the healthcare provider definition, remember we talked about that a little while ago related to the amendments, and the focus here is on only a very few specific things, and it's a focus on the employee's job duties. Individuals who are employed in diagnostic services, preventative services, treatment services, or other services that are integrated with and necessary to the provision of patient care. That's the definition under the FFCRA. And if you have an employee who falls into that definition, you as the employer may say, you are excluded from taking leave, okay? And so that is not the same, right, as a healthcare professional under PA 238, okay? Now, let's talk a little bit about first responder. That is also a different definition than what is under PA 238. PA 238 uses the term first responder. FFCRA uses the term emergency responder. And as you may guess, the term emergency responder is a bit more broad. So it's individuals who is necessary for the provision of transport care, healthcare, comfort, and nutrition of certain types of patients. So this can be military or National Guard, law enforcement officers, correctional institution personnel, firefighters, emergency medical services personnel. Those are generally included in the definition under PA 238, but also physicians, nurses, public health personnel, EMTs, paramedics, emergency management personnel, 911 operators, child welfare workers and service providers, public works personnel, and persons with skills or training in operating specialized equipment or other skills needed to provide aid in a declared emergency, and the individuals who work for such facilities who employ those individuals. So, moral of the story there, the definition under FFCRA is much more broad, and so we want to think about that. Although this question is not here on the screen, I think it makes sense to talk about right now really quick, is this idea of the small employer exception, that is also an exception from the FFCRA, and so I want to be really clear on what this is. So a small business with fewer than 50 employees can be exempt from providing emergency paid sick leave or expanded FMLA only for the child care, school or place of closure reason, only for that, and only under certain circumstances. And so the FFCRA says, when doing so would jeopardize the viability of the small business as a going concern. And there are a certain number of specific requirements that the small business has to make. You've got to have an individual, a high-level individual in your organization essentially attest that those are the circumstances at play at the time that an otherwise eligible employee is requesting leave, and so you fall into that exemption. Now, there's no document you need to fill out and send anywhere, and you get your certificate in the mail that says, yep, we give you the seal that you're qualified as a small business that is exempt from FFCRA. And that's good and bad. One is there's nothing you necessarily have to do and wait to get the official approval. But on the bad side of that is you don't know if you didn't fall into that exemption correctly until you get an employee complaint and the DOL is investigating that complaint and says, no, you didn't fall into that exemption. So I want just 2 seconds to say, take a look at the FFCRA Q&As on their website and really look at that criteria to make sure that you're, in the event that you are an employer who wants to kind of push that button of the ad exemption, make sure that you fall into those pieces. Okay. So next rapid fire question is, how much do I pay and when? And so what was really helpful at the very beginning when we were looking at all of those 6 reasons, we went through and said, this is a 100% regular rate reason, this is a 2/3 reason. So let's quickly talk about, remember, Emergency Paid Sick Leave Act of the 6 reasons. How I like to think about this, and to the extent that this is helpful, is if I am off for a reason to care for myself, that is generally going to be a 100% pay my regular rate type of reason, subject to the daily and overall caps, okay? But if I am off to care for someone else, so under emergency paid sick leave, if I'm caring for someone who's subject to a quarantine order or whose healthcare provider has recommended self-quarantine, or I'm off to care for my child whose school or place of care is closed, that's a 2/3 pay reason. And that's subject to the $200 daily cap and then the overall cap. So if that's a helpful way for you to think about it, you may borrow my shortcut there. Otherwise, what's also really helpful is that information is right on the FFCRA poster, that if you are a covered employer, you are required to post. So that can be your little cheat sheet to talking about which reasons are eligible for leave. And remember, I want us to continue to think about, yes, we talk about FFCRA broadly, but remember there's 2 separate paid leave provisions in there. Emergency paid sick leave is its own thing. Expanded FMLA is just adding one reason for FMLA to the regular FMLA, putting pay to it and making a few more people and a few more employees subject to it, okay? And so we want to remember to think about that, for example, say I exhausted my FMLA even before COVID hit, as an example, and I have no FMLA left. Well, we know under expanded FMLA, it's one bucket of time. It's 12 weeks total. And if I've exhausted it for some other combination of regular FMLA reasons, I don't have it available to me, but I still have up to 80 hours of emergency paid sick leave available. And to be eligible for emergency paid sick leave, I only need to be employed, right, by a covered employer. So I'm immediately eligible for that. On the flip side, if I've exhausted emergency paid sick leave, but I haven't used any FMLA, regular or expanded, I'm still eligible for expanded FMLA for the one eligible reason, as long as I'm working for a covered employer and I've been employed for 30 days. So remember to think about them as a little bit separate. Where it gets tricky, of course, is the needing to care for my child whose school or place of care is closed, because that's an overlapping reason. So that can get a little bit tricky. Okay, next question. Next two questions go a little bit together. How can my employee establish that he or she is a close contact? Okay, so remember first that close contact, we don't talk about close contact necessarily under the FFCRA. That's a Public Act 238 triggering reason, and to the extent that we think that Public Act 238 qualifies as a state quarantine order, that's kind of how it gets folded into the FFCRA conversation. So that's just a little bit of a back piece, just to continue to think about that analysis. But how can we establish that the individual is a close contact? Well, the really easy way, right, and would be the way that would be most helpful to all of us, is if that individual was subject to a federal, state, or local quarantine order, right? They got something from, the local public health department that says you have been identified as a close contact, and by order you are, you must quarantine for this many days, and here's the parameters of that. That would be ideal. Or, right, you tell your physician that you think you're a close contact, or your healthcare provider rather, that you believe you're a close contact, and the provider says, yep, I'm advising you to self-quarantine, and here's the documentation about that, and here's the parameters about that. So those would be perfect circumstances. But anybody on this call right now who has been in business for the last 8 months knows that that is more times the exception rather than the rule. And so long story short is you just have to take your employee's word for it, quite frankly. Absent some of the things that the examples that we just gave, that there's actually documentation that they've been given. Otherwise, you're really just taking the employee's word for it. Now, on the documentation front from an FFCRA perspective, remember that that's generally pretty limited, right? And it essentially that you can require your employee to furnish your employee's name, the dates the employee is requesting leave, the qualifying reason for leave, and an oral or written statement that the employee is unable to work, and very limited documentation outside of that, okay? And let's think about the reason why. Although we may start to feel, well, then we have employees gaming the system, and I can't keep, I don't know if people are really being honest, all those pieces. We hear you. We hear what you're saying, and we don't necessarily disagree that those things are happening. But remember, the whole thought of FFCRA was that it was supposed to be a temporary measure to get us past COVID, and that our healthcare systems are going to be so overwhelmed, they don't have time to be writing notes and substantiating, doing long medical certifications like we do in the FMLA or the ADA world, right? We need to just be providing people leave and giving them the ability to take it if they are experiencing one of those 6 qualifying reasons under emergency paid sick leave, or one reason under expanded FMLA, and just allowing that to happen, right? So essentially this documentation is going to consist of an attestation from your employee saying all of those things, right? So I meet one of those 6 criteria, and I'm certifying that the information or documentation that I'm providing you is correct, right? We can request, okay, you were seeing a healthcare provider has advised you to quarantine. What's that provider's name? And describe your efforts to seek diagnosis. We can do those pieces, but not much more outside of that. And if you think to yourself, as you just listened to that answer, that it wasn't very satisfying and you're not exactly sure what you can require, the good news is, for those who have been on our webinars before, you know that Miller Johnson has a COVID-19 resource center that has the forms that pass muster under the DOL and pass muster from an IRS perspective, right? Because they want to make sure you're only giving it to employees who are eligible to take it. And so if you are in need of one of those forms, you can hop on and take a look in the Resource Center, or you can reach out to Rebecca and I, and we can point you in the right direction to getting information on the Resource Center. Okay, last set here. Will FFCRA be extended into 2021, and what does 2021 look like? Next slide, please. So here. Sometimes I feel like this is literally all I know. When someone asks me what my future holds, all I know is I'm going to be hungry again in an hour. But if I was guessing, I would say we can read a little bit of the tea leaves here, right? In terms of what are the chances that the FFCRA is extended. All we have to guess on that is looking at what we know today. The first piece, if we remember, that the FFCRA originally enjoyed overwhelming bipartisan support back in March 2020, okay? The U.S. House passed the FFCRA by a huge margin, 340 to 40, and the Senate passed it by also a huge margin, 90 to 8, okay? So this was, right, passage of a paid leave law, the first time Congress has ever done that, despite it being on presidential and congressional agendas for decades, okay? So we know it was passed, right, related to a national health crisis, but we quickly saw kind of Congress get its act together in only days and weeks, and pass a paid leave provision with overwhelming bipartisan support. So that tells us what the mood at the time was. The second piece of information that's important for us to think about is we haven't overwhelmingly gotten data that suggests that the FFCRA has been particularly difficult or had a huge deleterious impact on American businesses, right? So if we're talking just anecdotally, we know that we've been counseling employers over the last 8 months, and compliance is difficult, and those pieces of pay are difficult. But generally, as we look at a whole, we're not getting the sense that the FFCRA has necessarily negatively impacted business. As we think about this pandemic and the things that are negatively impacting businesses, it's not necessarily the FFCRA and their obligations under it, okay? So we think that that is also something that might make an extension more likely. But we also know that the government has already signaled that the pandemic and the declaration, the formal declaration, is going to extend into 2021. So back in October, the U.S. Department of Health and Human Services announced that the public health emergency related to COVID-19 was renewed another 90 days. And so that extends to January 20th, 2021. And so that doesn't necessarily mean, that the FFCRA is necessarily hitched to the wagon of the public health emergency declaration, but all of those pieces together tell us that whatever we were thinking maybe back in March about the temporary nature of COVID, and that we would be through it and past it and so on and so forth by the end of 2020, for those of us with just some walking around sense, we know that that hasn't yet come to fruition. So although we do not know, we certainly would not be surprised if we saw an extension of FFCRA. But of course, that's something we are watching insanely closely, and you can be sure you will hear from us when and if we think that that is moving more likely in one direction than the other. Okay? So,
right.
So the next slide.
Awesome. And just picking up on that, you will hear from us. This is a great time to remind everyone, if you don't know, if you haven't been counting like we have, this is Miller Johnson's 99th COVID-related webinar. I'm not sure if that makes me proud or makes me want to cry. There has been enough reason this year to have 99 COVID-related webinars. That means that our next webinar will be our 100th COVID webinar, so expect something fun for our 100th webinar. Remember, as Sandy mentioned, we have a Back to Work Resource Center with all of the relevant forms, documents, policies that you need to survive the COVID crisis that we're dealing with. There we are, Sandy and I. Have a great day, everyone, and we hope to see you for our next 100th webinar. Bye-bye.